Hello, and welcome to another Debating Europe online panel. My name is Joe Litobarski, and I'm the editor-in-chief of Debating Europe. And today we're asking, are Europe's public health systems ready for the next crisis, be it a resurgence of COVID-19 in the autumn, a future pandemic, or another health crisis? How did they perform during the pandemic? How did health systems perform during the pandemic? And what lessons can be learned for the future? This is the first debate in a series we're running in partnership with MSD titled Healthcare Next, a citizen-centric approach. So we're kicking things off here. We want to keep things nice and general. We're going to take a couple of questions that you've sent us in on Debating Europe through some of our activities, including focus groups, and the panel is going to be responding and discussing what you have to say. But first, let's introduce our panel. So joining me today are Ingrid Keller, Head of Unit Health Security at the European Commission, DG Health and Food Safety. Welcome, Ingrid.
Thank you very much, Joe, for having me. Hello, everybody.
Thank you for being here with us. And also Agata Jakoncic, Managing Director at MSD Greece, Cyprus and Malta, and President of the Pharma Innovation Forum in Greece. Welcome, Agata.
Thank you for innovation, and thank you for opportunity to speak at that forum.
Okay, thank you. And we're going to start with, okay, so we've had, it's been a very strange few years. I mean, we've kind of normalized it, but we went through a pandemic. We shifted, those who could, to online work. We've kind of started running at Debating Europe a lot of these online panels during that, but we spoke to our readers during the pandemic. We asked them, during the height of the pandemic, we ran a series of online focus groups with young Europeans about their experiences, about life in lockdown, what they thought of the EU's response to the pandemic. And we published these as a report titled 100 European Voices. And one of the recommendations, one of the things that came out of focus group after focus group was plan for the next crisis now. I'll read you a comment from Dan, who said, right now, and this is during lockdown, this is the height of the pandemic, it says, right now, when people are still worried about being locked in their homes again, when they're worried about the next pandemic, we have the opportunity to put things in place to say, when it happens again, this is the plan. There's a moment that you can seize to prepare for the next crisis. And the question I have for both of you is, are you confident that Europe has seized that moment? Ingrid, maybe we could start with you. What would you say to Dan? Do you think that there are important, when it comes to kind of changes in EU policy on pandemic preparedness and response, have lessons been learned from the pandemic, and are they being put in place?
Thank you very much, Joe, and thank you very much to Dan for this very pertinent question. I think we have learned lessons, but we are still doing so because the pandemic is not over. COVID is here to stay. So I guess we are learned lessons every day, but we had to start somewhere to make changes based on early lessons learned. So in November 2020, the Commission published what we call the Health Union package. That comprises changing the mandates for two of our key agencies, that's the European Medicines Agency and the European Center for Prevention and Control. And the good news is that has been done for the Medicines Agency. That is done and sealed and published. For the ECDC, the Center for European Center for Disease Prevention and Control, we have the political agreement now, and that is moving forward. The center is very much aware of the new mandate, so they're already recruiting new staff and changing and starting to implement the new mandate. On top, you probably have seen the news at the end of last year, we also created what's called the HERA, the Health Emergency and Response Authority, which is now a particular authority really in charge of looking at provision, but also development of medical countermeasures. That's a very long word to simply say we need masks, we need hand gel, we need vaccines, we need to have the medications in place for the bug where we need. So one of the things that HERA is doing is also a foresight exercise, looking at what are the threats in the futures, and do we have medical countermeasures or not? Do we need to put money into research and development for that? And last but not least, the, let's say, the centerpiece, the overarching legislation for the new health security framework just has reached a political agreement last week between the European Parliament and the Council, which is the regulation on serious cross-border threats to health. That comes with a lot of strengthened elements. For example, one of the things we never had before, and which we will have thanks to this new regulation, is a union-wide preparedness plan. So how can the whole union be prepared together, and use also tools that we had to invent kind of ad hoc, like contract tracing apps, like passenger locator forms, like the ECDC, the electronic certificate. These are all instruments we had to invent. And now with the union plan, we can put them in place to be prepared for either new waves for COVID or for whatever new wave or new bug that can come to us in the future. I'm handing back to you, Joe.
Thank you so much, Ingrid. Okay, and I'm going to pick up on some of that. I'd like to ask you more about the ECDC mandate and also a little bit about the new health security framework. But let's go to Agatha. So some of the comments that we had were more critical, particularly at the beginning of the pandemic. We had one from Bert on our website, debatingeurope.eu, who said, with the huge mess in the EU around the vaccines, have the EU and Mrs. von der Leyen proved not to be capable of handling these problems? And for context, this was left at the beginning. This comment was given to us at the beginning of the pandemic, when the EU was falling behind in terms of vaccine rollout. Now, we all know that changed over the course of the pandemic. The EU's vaccine program did improve, but there was some criticism about the initial response. What would you say, Agatha, to Bert, who's quite kind of critical of the EU's response, pandemic response? So do you share that kind of feeling, or are you more kind of, particularly if you look at the long-term response, do you have kind of slightly more optimistic view of it?
So thank you, Bert, for the question. And I will start, this answer with maybe where Ingrid finished or lesson learned. First, I think there was a big lesson learned that there is a need for innovative solutions. The COVID-19 got us all unprepared, and it's a big need for innovative solution. So there is a need for European level mechanism to address any emergencies that might happen. And Ingrid has addressed that era, Health Emergency Preparedness and Response Agency, which is established exactly for the purpose of a better future, to offer the better future for European citizens. So there is a need to invest in innovative solutions for all the citizens around Europe, so that we will be prepared for next crisis, whatever might be, whether it is the next virus or next bacteria or whatever is there. Now, to answer the question about on the vaccinations, so I think the joint procurement and really the kind of effort to have a joint procurement and secure the vaccine for all European citizens. Let's not remember, maybe that question was at the beginning, but what the European Union tried to have it is equal access for every citizen in Europe. And I think, despite might be at the beginning, some, hurdles because nobody was prepared, I think which we have to recognize that it has been implemented that every citizen at the time when we start the vaccination get equal access to COVID-19 vaccination. So in order to wrap it up, lesson learned, yes, is a need for really have investment, in the new solution and being ready, but also the early investment, it should not be investment in the healthcare. It should not be seen as expenditure, as a cost, but it should be seen rather than a wealth for all European citizens.
Nice. Okay, I have a question. Actually, that's a really good point, and I'll come back to you on that. But I want to bring in Ingrid to expand on some of the points that she made. So you talked about the European Centre for Disease Control, the ECDC, and how the mandate has been changed. Could you explain a bit for our readers, and our viewers rather, what is being changed in the mandate and why?
Yes. So the ECDC sits in Stockholm and is our scientific agency supporting the Commission, but also the member states in their responses to any communicable disease, actually. And I would invite the listeners to go to their website, because also for citizens, that's pretty interesting to look at what they have. They also have different videos, Q&As, and they also run what we call the EVIP, the European Vaccine Information Portal. So if you're looking for a trusted source regarding vaccination, any vaccination, not only COVID, that's certainly a place to go. So the ECDC will be strengthened in several points. First of all, we will install at the ECDC what we call a European Crisis Task Force. And importantly, that will be a public health task force. We have at the European level, if there is an emergency, like a humanitarian emergency, could be an earthquake, for example, there is the option to ask for a medical team to come to the affected country, be it in Europe or be it outside Europe. But we didn't have the same option to do it at public health level. But if there's an outbreak, you need to possibly scale up your surveillance, you need to do certain detections where you need a sudden strengthening in your public health team. And this is something we can do now based on this new mandate. We will also work together with the ECDC, to give you another example, to overhaul the way we are doing risk assessment. The ECDC has a mandate to do risk assessment, but sometimes the risk comes from or has a relation to the environment, or it's a chemical risk. So now under the new mandate, we will bring in the expertise of all the other agencies we have in Europe, the European Environment Agencies, the European Chemical Agencies. So the ECDC will work together with them to make a joint risk assessment to be much broader and to give also more pertinent recommendations then to the affected countries what should be done. So maybe these two examples and the invitation also to check the website with a wealth of information also about other outbreaks. If somebody wants to look at regarding monkeypox, you find it there.
Interesting, good advice. Okay, Agatha, let's have a question. So we've talked a little bit about some of the issues at the beginning of the pandemic in terms of equipment, supply chain issues. There was issues with vaccination. You've gone into that, but of course, it's not just about equipment. It's not just about PPE. It's also about humans, staff. Healthcare systems are made up of doctors, nurses, healthcare professionals, and they've been under enormous pressure. The last 2 years have clearly been required a kind of heroic commitment. And this question from Karaman is really worried about the human resources, in a sense, the humans in our healthcare systems. He's worried about workplace mental health, particularly in the healthcare sector. Are health workers exhausted? Are they burned out after the pandemic? And how can we try to kind of address that? What would you say to Karaman?
So I think what you said, one thing, it's heroic work. We all have to recognize that all the healthcare workers, frontline healthcare workers, have done the heroic work, particularly at the very beginning, because we really didn't know a lot about the virus. So that was incredible work done by all of those healthcare workers, first-line healthcare workers. Now, have they been exhausted, have been dire, have been burned out, mental health? Probably yes, so we read about it, we listened about it, and it was immense work that they've done it. Now, I would address it more about how could that be avoided? So is there any way that we can avoid? And I talk about in the first question, so on investment, but here I would touch it more prevention. If we would invest in prevention, preventing the diseases, keeping the people outside of the hospital, and try to implement the new technologies, the new solutions, the remote care, the telehealth, as I said, prevention, immunization, and so on, people will be staying out of the hospital and there will be less burden on those healthcare workers. Secondly, what I want to highlight as well, an importance, is that healthcare workers, doctors, nurses, it's very difficult to be replaced. It takes years of education. It takes long education, long practice in order to deliver the good patient quality care. So that is very difficult to be replaced. That's why we need to have a good, resilient system going forward. How can we ease up the work of those healthcare workers, which they're much needed there, and healthcare, let's say, hospital organization to promote the well-being of their employees. And on the other hand, also to implement, as much as possible, any preventable solutions, anything that people with maybe chronic conditions or any other condition can be managed as much as possible outside of the hospital, so we ease up work of those workers.
Okay, perfect. Thank you so much. I want to ask you both actually a little bit about, because we've talked about various threats. I know that monkeypox was raised earlier by Ingrid. I'd like to kind of talk about, we're not necessarily out of the pandemic. We do need to prepare for the next crisis, but we could have another wave, maybe beginning already, perhaps in the autumn, maybe in the winter. So I want to ask you, how prepared, if we take everything that we've been talking about now, including the new legislation and mandates which are being introduced, will they be sufficient and ready if there is another wave in the autumn, in the winter? Ingrid, maybe I can put that to you, and then I'll put the same question to you, Agatha, but we'll start with Ingrid.
Thank you, Joe. Well, for example, making a union preparedness plan is nothing you do overnight. So that's, I think, the answer in a nutshell. This is why we have published in the end of April a Commission communication to the countries saying, get prepared now. Think about, for example, a booster dose for older people or those immunocompromised. Think about new surveillance strategies, because COVID is here to stay. And as we have seen, other threats can come along. So countries need to be prepared to, unfortunately, juggle several things at the same time. In this sense, we are working also with ECDC to get guidance out to the countries. What could a new sustainable testing strategy look like? You probably don't need to have testing booths at every corner, like at the height, but you need to do a sentinel through hospitals, through GP practices, to keep an eye on where are we in the COVID wave. Because also think about it, in autumn, you may have influenza coming along. The seasonal influenza was always there. We haven't seen much of it because people weren't meeting, people were wearing masks. So this is why we had very little influenza. But now, if we continue to not have, for example, a mandatory mask policy in public transport or in closed meeting rooms, we may see a lot of influenza this year, or relatively speaking to last year. So we may have COVID and influenza at the same time. So countries need to think and really seize the summer, also think about maybe, Agatha was speaking, innovation. What about better ventilation systems for offices, for schools, because it's important that kids go to school and meet their friends there and have offline school. So we cannot keep them back home, but we need to use and prepare and use these technologies in time. And so in order to be, when school starts again in September, allow kids to be there, possibly think about reintroduction of some of the NPIs, meaning mainly mask wearing, for example, in public transport. We may see these recommendations coming back. That depends on how fast the waves are coming. We are speaking about the new Omicron sublineages BA4 and BA5 now. We don't know if possibly, there's a complete new variant around the corner. And as I said, the influenza might also come along. So mask wearing, especially also when you deal with vulnerable people, can obviously also make a big contribution to avoiding an influenza wave.
Okay, I'll put the same question to you, Agatha, and then I have a question on innovation. But first, what do you think about the autumn and the winter and how prepared Europe is?
Well, so I think, that we cannot be prepared and fully prepared overnight, as Ingrid has said, but we want to have a resilient healthcare system. Okay, so the system that can address all the challenges and can address all the people, not only COVID patients, but also all the people who are waiting, to be treated or to be addressed. So I would see three areas, that are in development. And areas, digitalization and digital system. How can we use, the data? How can we digitalize more? How can you use the new technology? So I guess we all have in our phone the digital certificate, okay? We all have it. Look, that was a very first great example. How can we work, nationally and the European level and institutionalize something that was a benefit for everyone? So it goes step by step, but digitalization, health data, that is an area where we need to invest it. We are there, we are not at the end, it's a path. The second one, I would say, what we can prevent, let's prevent. Okay, so I think we are discussing about the booster shots. So if we can prevent the disease, let's prevent the disease. It's not only COVID. There are other diseases that can be prevented with the right measures, being immunization, being early diagnosis, being a screening. So if we can prevent, let's prevent. And that goes for the healthcare professional, for the public health authorities, but also for any European citizen. We need to be aware that if we can prevent, we should prevent it. And the third one, it's support for innovation. Now, innovation goes in the broader component. It's innovation in the way healthcare and nurses, workers are working there. How can we be more efficient? Innovation in the new products. By the way, it has never been before that in 1 year, a vaccine has been developed. So that has been unprecedented. It is the first time. So I would address it, those three areas. We started to work that. We should continue to work there. And what we can do it was a public health authority, healthcare professionals, European citizens, as an industry, as a broader audience. Digitalization, invest in innovation because we're investing in a wealth, not a cost, and in preventing what can be prevented.
That's perfect. And I'm so glad you brought up the topic of digitalization, because that's the question I wanted to ask you. It's from Catherine. I said we get some blunt questions on Debating Europe. This is no exception. This is Catherine who talking about remote consultation. So a lot of people, if they wanted to see their GP, their local doctor, the consultations during the pandemic were moved online. And that is an example of innovation. But she says she thinks remote consultations are a scam. These are her words, and that patients, particularly elderly patients, will always need to see doctors physically. So she thinks it was a way to remove that kind of necessary component as a kind of cost-saving measure. So how can we ensure that these technological innovations, digitalization in healthcare and innovation, is not just a cost-saving measure, but is genuinely improving the quality of care? What would you say, Agatha, to Catherine?
So thank you, Catherine, for the question. I would go here for lesson learned. We talk about exhausted healthcare professional there. These technologies, those remote consultation apps, telehealth, telemedicine, could help up a lot, for exhausted healthcare professionals that we just talk about that. But also it can help to the patient to get their info they are looking for or their services at any time, at any place geographically, rather than waiting time to get, the physical face-to-face visit to the doctors. Now, is that, as easily as it said? No, because Face-to-face visit will never be totally replaced. We are social people. We need a social connectedness. We are emotional people. So face-to-face will be there. But the question is how we put a good balance between the two. How can we utilize the technology for the benefit of the patients, and how can we have a face-to-face also for the social interaction, not social interaction, but really face-to-face interaction and discussion. And I would address one more thing, that some of the countries that I know as well, they have started also with digital education for the elderly people. Because today we are in an era for the digitalization, heavy digitalization, and some countries, they have a small community, kind of elderly community, that they introduce education, how to use digital services, which could definitely benefit elderly population. But I think is unavoidable way to go, that we need to use those technology and find a good balance between the two.
Okay, I think we're almost out of time, so I'm going to ask you one last question each, perhaps. So Ingrid, maybe I could put a question to you about the new health security framework. So we had a comment from Tihomir, who said there should be an EU-wide healthcare framework that synchronizes the local systems. Very, very supportive. Tell us a bit more about the new health security framework and what it's doing. And you mentioned that the aim is to regulate serious cross-border threats to health, and we've talked about some of them. But what sort of threats that maybe we haven't spoken about might it also be anticipating?
Yes, thanks, Joe, and also thanks to Tihomir. I'm happy to give you a bit more information about this new regulation on serious cross-border threats to health. So first of all, the scope includes all communicable diseases. So we also, so COVID is one, but I mean, we had other bigger outbreaks, for example, Ebola. It's still there. So fortunately, we also have with vaccination, we could really circumvent that. That's very good news. But we have different zoonoses, that sometimes jump to the humans. We have also seen with COVID, it went to mink, it went to foxes. So especially this animal-human interchange with more humans and animals also living closer together. If humans live more, expanding cities, for example, and then you have more exchange or more contact with wild animals, you never know what might occur there. But then also in our framework, we include chemical threats. That is, it could be a deliberate release, could be an accident from a factory or so. You have a chemical cloud moving between different countries over Europe, so it becomes a cross-border threat. We also have biotoxins. So we are really looking at all the threats except radionuclear that has a different legislative framework in Europe. So with that, what is also maybe an interesting aspect in this new regulation, what I could highlight here is that the Europe will be independently have the option to declare a European public health emergency. So until now, we usually look at the World Health Organization to see, do they declare a public health emergency, yes or no? But if it's something, let's see, local in Europe affecting 5 or 10 countries, maybe for WHO at global scale, they wouldn't say that is a global outbreak, but for us in Europe, we would decide, yes, it is. And that actually then triggers what we call a crisis framework to come into being, under which HERA then has new instruments to more rapidly, for example, procure, to get quickly also different funds for supporting the affected countries. So that is a mechanism which also hasn't been there before. So with COVID, we had to wait until WHO declared. Then we said, oh, what this actually means for us. We had to look at which are the pots we could possibly use. So this is much more structured now. If we have a public health emergency in Europe, other legislation kicks in, funds kicking in. So this is, I think, also good news that this is a new instrument in place, which can be, well, I always say this is hopefully the article we will never need, but it is there in case, because I mean, this topic of the session was be prepared for the next crisis. So voila, yet another article we are prepared, but that's the favorite one, which I hopefully would never be using.
Indeed, and the risk, of course, is always that you're very prepared for the last crisis and not indeed for the next one. It sounds that that's not the case here, so hopefully that's true. Final question. Okay, we kind of come full circle because this is also about the sort of supply chain issues. It's from Isabella. I'm going to put it to you, Agata. So Isabella argues that global supply chain chaos, her words, during the pandemic demonstrates how we have prioritized efficiency, so just in time, that sort of thing, over resilience, over supply chains that can take disruption and continue to function. Is she right, do you think? And would more resilient European healthcare systems need, for example, shorter medical supply chains? We hear a lot about autonomy, strategic autonomy, and so on. Is that something that you'd like to see? What would you say to Isabella?
Well, thank you, Isabella, for the question. So I think first we have to clarify that the supply chain are very complex and require multi-stakeholder collaboration. That's not an easy game. It's a very complex overall. Now we support overall the data and the data-based decision system. And I think we have to look at that. How can we further optimize the data in the supply chain so that we have appropriate supply across the countries and we avoid any possible distortions. So data will be critical in this way so that the companies and we can have the proper supply across the countries, not oversupply, which we see sometimes, not undersupply. So just appropriate in-time supply. Now, on the other hand, this is one of the solutions that I see, but on the other hand, I think we have to look at also from the regulatory framework. Can we shorten regulatory procedures? Would electronic product information help, the overall better supply optimization? Would digital patient leaflet also help in overall shorten the supply chain and better supply across the country? So that is complex. A lot can be done. A lot can be done with data, but a lot can be done also the regulatory framework in order to optimize and have better supply in time and in place. On time and in full, as we said.
Okay, we're going to end on that. But as I said at the beginning, this is just the first in a series of such debates that we are running. So thank you to Agatha and Ingrid for helping us kick this off. We're going to hopefully expand on some of the questions and the issues that they brought up in later debates in the series as we go forwards. Thank you for sending in your questions and comments on Debating Europe, taking part in our focus groups and so on. Thank you for watching at home. Thank you so much. Stay tuned. As I said, we'll be holding more of these. And everybody have a fantastic rest of the day. And thank you for taking part.